Well, hospitals are preparing to be overwhelmed. The latest projection from Governor Newsom is that 56% of Californians will get infected in an 8-week period. Investigative reporter Candice Nguyen found what this would do to our healthcare system.
Here at the Santa Clara Convention Center, the feds are building an emergency medical center inside in case local hospitals run out of room. Our unit wanted to take a closer look to see if the Bay Area can handle the peak of this pandemic. What we found paints a picture, experts say, of what can come.
So I guess I'm anxious about what things are going to look like in a few weeks.
Turning 70 next week, John Baum should probably stay home and not risk contracting COVID-19. But he's a doctor. He doesn't have that luxury.
I'm doing an extra rotation in April that I wasn't scheduled for.
As a physician at Zuckerberg General and a professor at UCSF, Baum says San Francisco hospitals are preparing for a surge of infected patients.
New wings ready to go. Mobilization of ventilators, increased in ICU beds.
Does the Bay Area have enough hospital beds?
Well, we'll see.
According to projections analyzed by NBC Bay Area's investigative unit, the answer is no. In some scenarios, not even close, especially in light of Governor Gavin Newsom's recent pronouncement about California's worst-case scenario if the state takes no precautions.
It's fair to say that if we're looking at a 56% rate of the virus attacking those out on the streets and sidewalks.
If more than half our population becomes sick within 6 months, data from Harvard Global Health Institute shows hospitals could be overwhelmed. The Bay Area would need about 5 times the number of hospital beds it currently has. Even if the infection rate only hits 20% in that time, we'd still need double the number of beds. The projections show there would be an even greater shortage of ICU beds and critical life-saving equipment like ventilators. That's why experts preach social distancing to reduce the number of infections and spread them out over a longer period of time. What will it look like if we are overloaded and there aren't enough hospital beds and ventilators and other kinds of equipment?
Then people will die who otherwise could be saved. I mean, that's what's caused the high death rate in Italy, is they literally don't have enough beds to take care of everybody.
Bay Area nurses tell our investigative unit they're already feeling the pressure.
It scares me. Nurses are afraid.
The first thing we're looking to do is to make certain that our own surge capacity plans are in place.
Carmela Coyle is president and CEO of the California Hospital Association, which represents hospitals across the state. To prepare, she says hospitals are discharging some patients, canceling elective surgeries, and ramping up hiring.
And the real issue that we have to think about is not just the physical capacity available in hospitals, but of course that human capacity, the nurses, the doctors, the other caregivers who we will need.
Baum will soon be part of that human hospital element. His rotation starts in April.
I actually have a desire to be on the front lines with my colleagues.
But he is anxious. It's not just his health he's looking out for.
My wife, who is almost as old as me and has asthma, she's concerned for her health, and she's worried that I'll bring back COVID-19.
Governor Gavin Newsom has expanded the state's response to COVID-19, but admits we may need help. He has asked President Trump to help with a naval hospital ship off the coast of California to assist with possible patient overflow. With the investigative unit, Candice Nguyen, NBC Bay Area News.
All right, thank you, Candice. Now, if you have a story for our investigative unit, you can give them a call. That number right there on your screen, 888-996-TIPS, or you can go to the website. That's NBCBayArea.com/investigations.